Okay, today we are going to discuss one important topic, that is health research policy, national health research policy, and there are various kind of research. Clinical research is also there, and this is a health research. It is something different from the um clinical research. So first we have to understand what is the actual research in the health field or in any field in general. What is the setting of the research? So in any typical kind of research, first we have to why we are doing the research, because we want to give something new. We want to address some problem in some innovative way or innovative manner. The first thing is that we have to identify what is our problem. Okay. And after identifying the problem in any area, just big area, you can think upon that. If there is any problem, then you have to gather information about the background. What are the reasons of the problem? What is the current situation? Then you have to understand what is the current situation, and then you have to apply some kind of statistical tools and all that to establish or to check some kind of hypothesis. And after you are getting the result, when the things are established, okay, this problem is because of this or something like that, then you can utilize this knowledge in the ground, and you can convert it into the implementation kind of thing. Then you can suggest what are the measures you can use that if something is find correct. Suppose if I take one example, uh, regarding if I take example as a maternal mortality rate is higher in some area, and ये हमें पता है, we know this thing कि maternal mortality rate is very high in some area. Then we find out what are the reasons, what are the various factors, variables which are responsible for the maternal mortality rate. Then we have to see what the solution can be, whether this maternal mortality rate is directly related with one variable or multiple variable. That is the statistical part. Means we have to do some kind of analysis, and after doing the analysis, when it is established the maternal mortality rate is because of this one factor or because of this other two factors or something like that, multivariable kind of things, then you start thinking upon the solution. कि हम इस problem, how we can address this problem, and whatever the solution or whatever the things come into your mind, that goes into the research part as a recommendation part. And somebody can take the that advice or some recommendation into some form of the pilot project. As it is always advised, if you want to start any change or something like that, it is always start something like as a pilot project rather than implement across the whole area. So this is the basic theme of the research. We are doing the research in all areas, something like that. So before 2007, when research was being conducted, it was not like that. Research was not being conducted. Research was being conducted since beginning. But you need some kind of official, or you can some kind of professional kind of framework is required to conduct all these kind of things. So initially it was being done, but it was in a very fragmented manner. Lot of stakeholders, they were doing the health research. They publish the result also. Sometimes they use the um, uh, they utilize this information in the ground also. That's why we need some kind of research policy or something like that, which can stabilize the system, research activities, ताकि हमें पता लगे कि where we are कि हम whatever the research findings जो हमने निकाली हैं वो एक्चुअली में कितनी फायदेमंद है, कितनी यूजफुल है, and if it is useful for some portion, then it can be implemented to the other. So that is the purpose of this national health research policy, and it's a kind of systematic generation, analysis, and the application of the scientific knowledge. And what is the purpose? To promote health and well-being, restore health through treatment and interventions, maintain optimal health across populations, and protect individuals and the communities from diseases and the health risk. So if you see, maximum portion is related to the talk about the public health. So that's why this is called health research, not the clinical research. And if we talk some little bit history or some we see the background of this national health research policy. So in way back 1991, when the Indian Research Fund Association, the precursor of Indian Council of Medical Research, nowadays that is known as the ICMR, but in the time of 1911, it was known as the Indian Research Fund Association. Okay, so that was established. But as I told you, there was not a clear-cut policy laying down the principles to guide decision until unless ICMR they have specifically formulated a health research policy in the 2007. And after this, this in 2007 and onward, there is a clear-cut guideline for conducting the health research. So that is the thing, and why this health research policy is needed. Now, question arises कि why we need this? The health research was already going on, तो हमें इस health policy की जरूरत क्यों थी? क्यों हमें बनाना था? So first, you see, there was a historical gap. Means no for formal policy until 2007. So as I told you, research were being conducted, but it was not, you can say, streamlined kind of thing. And sometimes important research, they were just wasted because they were not compiled in a very concrete form. Then fragmented research landscape was there, but some people, public health personnel, they are doing the research, private sectors, they are doing NGOs, they are doing their own international agencies, they are conducting their own health research. And it was all fragmented kind of thing because there was no single platform. So everybody was doing just in their manner. जैसा उनको अच्छा लगता था वैसा they were doing that. And third, policy is required to align with the national goals. Whatever the research, health research that is being done, that is already done or that is going to be done, that should be aligned with the national goal. Otherwise, हम हमारा नेशनल गोल कुछ और है और हम किसी और रिसर्च में लगे हैं, देन इट इज नॉट गोइंग टू बी वेरी वेरी फ्रूटफुल. एंड हमारे जो नेशनल गोल आज की डेट में आप देखो तो इट इज NRHM, NHM, ओके, MDGs, SDG, भारत निर्माण, लॉट ऑफ थिंग्स आर देयर which are considered as a universal health coverage. These are all the national goals. So whatever the policy aims, whatever the research is being conducted, they should be aligned with this NRHM. So suppose we talk about this National Rural Health Mission. So there was Ayushman Bharat is there, and what was the purpose of this? That purpose is that ki rural healthcare access and to reduce the maternal and the child mortality. ओके, हेल्थ रिसर्च इसका कैसे इससे अलाइन करेगा? दिस इज वन, यू कैन से, गोल. नाउ यू सी हाउ हेल्थ रिसर्च, एनी रिसर्च एक्टिविटी, हाउ दिस अलाइन विद दिस गोल. तो a 2015 ICMR study on the delivery care in the rural Uttar Pradesh found that 40% of the women delivered at home due to lack of transport. ये ICMR ने एक रिसर्च स्टडी किया. ओके, वाई उसने रिसर्च स्टडी किया? क्योंकि देयर वाज अ गोल. उसके अकॉर्डिंग उसने एक स्टडी किया और गोल क्या था कि हमें कैसे रिड्यूस मैटरनल और चाइल्ड मॉर्टेलिटी रेट को कैसे कम करना है. ओके, तो उसने ये चीज बताई. एंड उसके बाद क्या हुआ? जो NRHM है, दैट इज द नेशनल एसोसिएशन जो है अपना नेशनल रूरल हेल्थ मिशन है, व्हाट दे हैव डन, दे हैव एक्सपेंडेड दिस जननी शिशु सुरक्षा कार्यक्रम JSSK. And under this कार्यक्रम they involved, they catered for the free ambulance services 102, 108. So now you see कि there is a research, means ISMR has collected some data and they found that ये एक स्टडी किया गया and उसमें जब उन्होंने they have collected the data and then they have done some kind of statistical test, then establishment of some cause is there कि why this has been happened, that is because of the transport. ये हमारा रिसर्च में क्लियर हो गया. नाउ वी हैव टू सॉल्व दिस प्रॉब्लम. तो हाउ दे हैव डन दिस? दे हैव स्टार्टेड दिस फ्री एम्बुलेंस सर्विसेज टू द प्रेग्नेंट वीमेन. ओके, इसी तरीके से इफ वी टेक द सेकंड एग्जांपल, दैट इज द आशा वर्कर. हमने देखा इनिशियली देयर वाज अ लार्ज गैप इन द नियोनेटल केयर और द पोस्टनेटल केयर, and this was also being researched by some agencies. And afterward, NRHM, they have revised the ASHA training modules. They have included lot of modules which gives address to this neonatal care, skill wealth, attendant kind of training they have been provided. That is all based on some kind of research. And what is the impact of that? Neonatal mortality rates were reduced by 21% in 5 years. So my purpose of giving this example is that just you understand कि whatever the research we are doing in the public health or the health research, they should be aligned with some kind of goals. It should not be something like that कि आप ऐसा ही उसके करते रहो. अब second example, as I told you, Millennium MDG or SDG, Millennium Development Goals and the SDGs. I told you many times कि it is always better कि you should go for this MDG and what are the SDG. They are very important part of the public health. Sometimes, if I get the time, I will take the class on this sustainable development goals also. That they are very important. Under this MDG, there was a MDG 4 that reduced child mortality, and the MDG 5 that improved maternal health. Okay. Health research alignment कैसे हुआ? One study has been conducted and it was revealed diarrhea caused 13% of under 5 year death in India. Diarrhea is responsible for that. Okay. So what was the impact? इस research का impact क्या किया गया? Program को we have realigned and National Diarrheal Control Program that has been scaled up with the ORS and the zinc distribution. Initially, it was only the ORS distribution. Then the cause has been revealed by the research. Diarrhea is one of the major factors. So zinc was added in the ORS part, as zinc has protective action on in the this loose motion kind of thing, and lot of mortality has been reduced. So this is the impact of the research. Sir, research on maternal anemia, postpartum hemorrhage, 50% postpartum hemorrhage death, they are because of this anemia. अब नाउ यू सी ये जो 50% का फिगर है ये ऐसे अपने आप नहीं आया. दिस इज ऑल बिकॉज ऑफ द रिसर्च. रिसर्च का आपके पास आउटकम आ गया. अब अगेन प्रोग्राम क्या करेगा? दे स्टार्टेड एनीमिया मुक्त भारत, प्रायोरिटाइज आयरन फॉलिक एसिड सप्लीमेंटेशन based on that particular research. So that is the impact of the health research, and because of that only the health research is very important. If we talk about this Bharat Nirman, as we see, India is a very populous country, and the people are living in a very remote areas where there are a lot of facilities. It is not possible to create the facilities and all. So there were referral were very high, on the very higher side. That was again a finding of the research. Referral services were very high. People have has to travel from one remote areas to the some big areas for getting some kind of treatment or some kind of advice. So what were the intervention has been done? That is the telehealth services started. And उसका फायदा क्या हुआ? That telehealth services, they have been started in various villages, and you can easily understand if for that whatever they are going to travel, they have to travel to take the opinion or the advice from the competent person. Now they are getting all that kind of things on the teleconsultation. That reduces the referrals. रेफरल डिले हो गया, डिले मतलब रेफरल इज रिड्यूस. लोगों का जो आने जाने का जो परेशानी था, कम्युनिकेशन प्रॉब्लम, वो कम हो गया. तो ये सारे फायदे हैं रिसर्च के. फिर क्रॉस कटिंग एग्जाम्पल यदि हम ट्यूबरक्लोसिस का लें, because nowadays it is tuberculosis, controlling the tuberculosis is on very much high priority. So this tuberculosis control is involved in various programs. It is also involved in the MDG 6, combat HIV, AIDS, malaria, TB. उसके साथ है फिर एनआरएचएम में टीबी डिटेक्शन वाया रूरल पीएससी वहां पे भी होने लगा. फिर यदि हम निर्माण पार्ट पे देखें, इंफ्रास्ट्रक्चर पार्ट पे, तो डिस्ट्रिक्ट लैब है, दे हैव बीन अपग्रेडेड फॉर द ड्रग रेजिस्टेंट टीबी टेस्टिंग. अभी आपका सीएससी पे, डीएच पे, सब जगह आपका ये टेस्ट, आपका टीबी के जो टेस्ट है, पीसीआर काइंड वाले जो टेस्ट हैं, वो सारे जेनेटिक टेस्ट, दे ऑल स्टार्टेड. So that is because of that research. That is the research backing. ICMR they have done ki TB prevalence survey revised based on that. The National TB Control Program that has been revised. because ICMR has given some kind of input to the authorities. By implementing this revised national TB control program, mortality is already automatically it comes down. So this is the actually the importance of the health research. If we are not able to utilize the findings and the research result of this research, then it is waste actually. And we have enough data. We have some more than sufficient data we have. And only thing is that we need some good data engineers, we need some good scientists so that they can. I'm not talking about I'm not talking about artificial intelligence or something like that. These are the two things. One is the data scientist and one is the data engineer. And must understand the difference between these two terms. Who are the data engineers? Actually, they are the persons who give you or who tells you in which format or in which manner you are supposed to collect the data. Matlab, they are telling you, they are creating the format or the template for collection of data in a smart manner. Because until unless your data is not smart, it is not possible to analyze. So they call as the data engineers. They are just giving a typical kind of framework to collect the data. ऐसा नहीं कि बस आप गए और डेटा आपने लेना शुरू कर दिया, पूछना शुरू कर दिया एंड फिर आप उसको एनालाइज कर पाओगे. इट इज नॉट पॉसिबल. फिर जो डेटा साइंटिस्ट है एक्चुअल उनका क्या काम क्या है कि जो उनको डेटा इंजीनियर डेटा दे रहा है उसको वो एनालाइज करेंगे प्रॉपर उससे. दे फाइंड आउट सम काइंड ऑफ रिजल्ट एंड दे विल प्रोजेक्ट दिस रिजल्ट और दे विल प्रेजेंट दिस रिजल्ट टू वेरियस स्टेक होल्डर्स. And after seeing this result on the PowerPoint presentation or something like that, then we can decide on some policies or we can take some policy decision or all that. So these are the 2% data science, data scientist and the data engineer is important. Okay. इसके बाद now we are coming to this artificial intelligence. तो वहां पे we need some software engineer for the machine learning and all that kind of things. So that some kind of artificial intelligence can be utilized. Now in the public health also, a lot of artificial intelligence that came up. I have just written one research paper. What is the use of this implication of the artificial intelligence in the public health? Okay, so just it is on writing stage. I have just almost completed this in under the revision part. तो वहां पे पता लगता है कि we can utilize this artificial intelligence in the remote areas or in the tribal areas of the hill areas very effectively, and we can get the live data. That is the beauty of this artificial intelligence. So over a period, it may be we are going to utilize this artificial intelligence aggressively in the public health. Key features of the health research क्या होते हैं जो मैंने बताया आपको शुरू में बताया. इट इज ब्रॉडर देन मेडिकल रिसर्च. मेडिकल रिसर्च में क्या होता है कि दे मे बी लिमिटेड विथ वन सिंगल पॉपुलेशन वन सिंगल पर्सन एंड ऑल दैट. वाइल एज जो मेडिकल हेल्थ रिसर्च है वो इट्स a broader concept. It deals with the community, it deals with the country, it deals with the state and all that kind of person. And this includes biomedical, clinical, epidemiological, behavioral, social, environment, and all these kind of system in this health research system. Second, जो भी research होगा, they are going to be evidence based, whether it may be the health research or the clinical research, and it is a multidisciplinary, particularly health research. That is a medicine part is there, public health part is there, economics there, sociology there, and technology is also there. So in the health research, this is the multidisciplinary. In the clinical research, it may not be multidisciplinary. वहाँ पे public health होगा नहीं. Then it should be the equity focus. Means जो भी आपके prioritize करने हैं आपको जो underserved population है या vulnerable population है उनके ऊपर ये health research focus करता है. So that उनकी प्रॉब्लम को हम एड्रेस कर सकें. एक आपने एक और रिसर्च सुना होगा दैट इज द ट्राइबल हेल्थ रिसर्च. अब यू नो दिस ट्राइबल पॉपुलेशन दे आर द वल्नरेबल पॉपुलेशन और द अंडरसर्व्ड पॉपुलेशन. उनका जो रिसर्च है दैट इज ऑफ द डिफरेंट काइंड. So in the later part of the slide, just for information, I have included 3-4 slides of that also. And जो हमारा ये अलाइनमेंट जो मैंने अभी आपको बताया, इससे हमें फायदा क्या होता है. यदि हम अलाइनमेंट नहीं करेंगे देन क्या होगा. देर आर लॉट ऑफ डुप्लीकेशन. मीन्स People are conducting one research and they are again conducting the again one more study for that. Suppose somebody has conducted some one public health personnel, he has conducted why the maternal mortality rate is higher in some part of Madhya Pradesh. Again, some other agency, NGOs, they started again conducting that. तो ये सारे जो प्रॉब्लम है ना वो ये नेशनल हेल्थ हेल्थ रिसर्च पॉलिसी में आके दैट ऑल प्रॉब्लम वर रिड्यूस्ड कैन बी रिड्यूस डुप्लीकेशन नहीं होगा अदरवाइज इट्स जस्ट वेस्टेज ऑफ टाइम और वेस्टेज ऑफ रिसोर्सेस उसके बाद इक्विटी वाली बात मैं ऑलरेडी बता चुका हूँ एंड जो थर्ड इंपॉर्टेंट पार्ट है कॉस्ट इफेक्टिवनेस जो हम हेल्थ रिसर्च करेंगे हेल्थ रिसर्च करते हैं वी नॉर्मली सी कि वेदर इट इज कॉस्ट इफेक्टिव और नॉट तो ये पॉलिसी जब हमने बनाई नेशनल हेल्थ रिसर्च पॉलिसी उसका मकसद ही यही था इन सारी चीजों को एक साथ लाना और कैटर करना so if we see this, what is the vision of this policy? This is the forward part of this chapter, National Health Research Policy. What was the vision? It was the vision maximize returns on the health research investments by creating a coordinated system for ethical and priority-driven research. ये नहीं है कि आप कुछ भी उठा के रिसर्च करने लगे you have to identify your problems and then you have to prioritize your problem also and then you can allocate your resources your technology and everything to solve that issues okay second जो important vision था it's always there in the public health you have to focus on the vulnerable population for the translational outcomes and what is the translational outcome it is the real world application that is considered as the translational outcome सपोज आपने कोई रिसर्च कर ली बट उस रिसर्च को यदि आप रियल वर्ल्ड में उसका इम्प्लीमेंटेशन नहीं कर पा रहे हैं तो that is not a translational outcomes research is good it has given a very good idea it has also recommended a very good measure but if you're not able to apply that measures in the practical then outcomes they cannot be labeled as the translational outcome. So that is very important in the public health research or any research, whatever the recommendations are there, that can be public, that can be practically some practical implications should be there. इसलिए जो whatever the research we are doing, always we have to mention what are the practical implications. And ठीक है, research is an ongoing activity, so that is why we have to mention one more para or one more kind of addition is required. That is the future scope of the research. What means जो हमने कर दिया, suppose what we have done, it is not the end. Further, based on more data, based on different kind of methodology, something else can also be find out. वो भी ये चीज है तो वो सारी चीजें they are the part of the research. I am not going into the detail of that. Okay. So that is the vision of the policy. And if we talk about the objectives of the policy, National Health Research Policy, identify priorities aligned with the national health population, NRHM, MDG, SDG, whatever the goals are there. Foster intersectoral coordination. It's very important. Public, private, and academia. What was actually happening before 2007? People were doing research, but they were not coordinated. So this intersectoral coordination is very important. Until unless you don't do that, any research उसका कोई फायदा नहीं होगा या उतना फायदा नहीं होगा जितना होना चाहिए. फिर we have to focus on the marginalized group. They are tribals, they are women population, they are the rural population. Then strengthen research network and the public-private partnerships. It is very important. The government should give more part of the GDP or more part of the expenditure, current health expenditure on the research part, which is actually not as much as high in comparison to the other world. Then assess cost effectiveness of the intervention. जो भी हम इंटरवेंशन करते हैं उसका हमें कॉस्ट असेसमेंट करना है एंड आज की डेट में इफ वी सी दिस पार्ट दैट इज कॉल्ड एज द हेल्थ टेक्नोलॉजी असेसमेंट दैट इज एंटायरली डिफरेंट सब्जेक्ट दैट इज आल्सो वेरी इंटरेस्टिंग सब्जेक्ट कि व्हाट इज द हेल्थ टेक्नोलॉजी असेसमेंट देन ऑब्जेक्टिव ऑफ दिस पॉलिसी इज develop human resource and the infrastructure without having a good qualified human resource and the infrastructure it is not feasible to conduct any good research or something like that. So we need some infrastructure or policy that can to develop human resources and the infrastructure in terms of the data collection, in terms of the various other statistical analysis support and all that kind of things. So that needs this policy, national health research policy, they ensure all these areas. And if we talk health research areas, we have to understand there are the epidemiology, health system research, behavioral research, translational research. Okay, and they are the self-explanatory term. Epidemiology, we have to understand, we have to study disease pattern. Health system research, evaluating access to the care in the rural areas. Behavioral research, understanding barriers to the vaccines uptake. This is one example just I have given to make you understand. There are many other things. And transitional research, that is the convert whatever the lab discoveries, whatever the research findings that can be converted into the public health intervention. So these are the few typical areas of that. And we talk about this area biomedical
So,
research. We talk about this biomedical research area.
sir, your
Yeah.
screen.
अच्छा स्क्रीन नहीं दिख रही है?
No, sir.
ओह एक मिनट. See this biomedical research means biological mechanism of disease, drug development, genetic. They're all the part covered under this biomedical research. And if you take the example ISMR, the vaccine efficacy for the TB in the India, that is a part of this biomedical research. And how this research is going to help? We can modify, we can do lot of things with the TB control strategies if research gives some kind of input to us. Then we talk about this epidemiological research. As already told, this tells you disease pattern, risk factor distribution in the population. The National Cancer Registry Program tracking cancer. They used to tell the incidence rate across many various states. Okay, just one example is their high risk region, that is the Punjab's cancer belt. That is also being identified through this program tracking system, and we can make some good public health policies to tackle this problem, particularly in the Punjab or any area which has been identified by this tracker. Then we talk about this health system research, and main thing is that then in this health system research, we have to see the what is the problem in the healthcare delivery. Is there any problem in the access, cost, and quality? These are few things which are directly related with the health system. And यहाँ पे we see the evaluation of the Ayushman Bharat or PMJA, any kind of gaps that can be covered. Okay, and based on that, suppose we find this result कि जो marginalized population है और जो या जो vulnerable population and they are not getting this benefit of this Ayushman Bharat PMJ. So we will try to make them in pull them into the system or whatever the things are required as a public health professional. We will do that. Then we talk about this social and the behavioral research that is basically related with the cultural beliefs, stigma, and the health seeking behavior. One thing regarding this menstrual hygiene, there was a lot of stigma was there. Initially, people were they just hesitant to talk about this kind of thing. And in various states, it was considered as a social stigma. But when the problem was arised or in the research, it came out in the Rajasthan, in a particular area, there was adults and girls, they were facing that kind of menstrual hygiene problem. तो क्या फिर हमने वहां स्टार्ट किया, वी स्टार्टेड द अवेयरनेस कैंपेन, affordable sanitary product distribution, all this kind of activity has been started. So from where we get this input, we are having such kind of gap, that is again the part of research. But that is a different kind of research. That is the where we are doing the research that is based on the social culture beliefs, stigma, or any kind of behavioral aspect of the community. तो इस तरीके से in different areas we do this. फिर then we if we talk about this environmental health research, okay, we do the some research जैसे दिल्ली में हुआ कि दिल्ली रेस्पिरेटरी डिसीज एम्स हैज कंडक्टेड स्टडी एंड दे फाउंड कि पॉल्यूशन इम्पैक्ट पॉलिसी बनाई गई कि स्ट्रिक्टर वैक्यूलर एमिशन नॉर्म, BS6 की गाड़ियां कम से कम होनी चाहिए, गाड़ियां 10 साल पुरानी नहीं चलेंगी, ऑल दैट काइंड ऑफ रूल्स दे हैव बीन मेड। उनके पीछे भी वट एवर द रीजन इज देयर, दैट इज द रिसर्च कि and its research can be conducted by the AIMS itself Delhi, and they have found this factor कि pollution is one of the major, there are various factors which are responsible for the research disease, तो actually respiratory disease, but हम research में वही करते हैं कि maybe there are 10 factors, but उसमें respiratory जो this pollution factor है, उसका जो significance level है, that is on very higher side। statistical तरीके से जब हम देखेंगे, तो दे आर मोर डायरेक्टली रिलेटेड विद द दिस पॉल्यूशन। तो वी हैव टू एड्रेस दिस पॉल्यूशन। और भी चीजों को हम एड्रेस करेंगे, बट एज आई टोल्ड यू कि वी हैव टू प्रायोरिटाइज द प्रॉब्लम। इफ मेन प्रॉब्लम इज द पॉल्यूशन, देन वी हैव टू टेक सम काइंड ऑफ प्रायोरिटी। ओके। और फिर सेकंड रीजन में भी देयर कि ओल्ड एल्डर पॉपुलेशन दे आर आल्सो सफरिंग फ्रॉम दिस रेस्पिरेटरी डिजीज ड्यू टू लैक ऑफ वैक्सीनेशन। तो वुड सपोज दैट परसेंटेज ओनली 10%, तो उसको भी हम टैकल करेंगे। इट्स नॉट लाइक दैट कि हम सिर्फ एक ऑलरेडी आई हैव टोल्ड यू व्हाट एवर द रिसर्च गिविंग इन योर रिसर्च और recommendation is give few areas. Now, public health में इनकी based on this research, we reshape our policies, whatever the existing policies में हम change कर सकते हैं। Then third is that as by कर डालनी है यहाँ पे, so then low cost diagnostic tool, maternal antenatal kit, all these kind of things, they are all the part of the operational research. Okay. अब just make you understand कि what is the difference between this health research and the medical research. Scope, as already I told, it is a population level, holistic, and there are a lot of determinants will decide the research. While in the medical, it may be the most of the time individual level, and it's basically related with the disease and the treatment part. Okay, they're not addressing any determinants or something like that directly. Example, if we see the example support rate, मतलब समझे आपकी, एक टाइम में जब हमने रिसर्च किया, तो पता लगा स्कूल में बच्चे उतने नहीं पहुंच रहे थे, एंड उसका जब हमने कारण पता किया, तो कारण वाज दैट कि दे वर नॉट दे वर मैक्सिमम चिल्ड्रन दे वर नॉट गेटिंग प्रॉपर काइंड ऑफ न्यूट्रिशन। तो उसके बाद उसका आउटकम क्या हुआ? गवर्नमेंट ऑफ इंडिया दे हैव स्टार्टेड दिस MDMP, मिड डे मील प्रोग्राम। तो दीज आर द इम्पैक्ट ऑफ दिस हेल्थ रिसर्च। एंड इसी तरीके से इसको एग्जाम्पल में मेडिकल रिसर्च में देखें, सम क्लिनिकल ट्रायल फॉर अ न्यू डायबिटीज ड्रग हैज बीन डन एंड दैट वाज सक्सेसफुल। तो अल्टीमेटली क्या किया, जो आपका फेडरेशन ऑफ ड्रग एसोसिएशन है, दे हैव गिवन द अप्रूवल फॉर द मेडिकेशन फॉर दिस ड्रग। So that is the basic difference between these two for understanding understanding. And under this national health policy, okay, ignore this. This is the just old template. Under this policy, there are three things has been created. One is the NHRS, that is the National Health Research System. Second, forum, and third is the operationalized 10-point action program. ये तीन were the things today I am telling you, that is all based on this national lot of things from that document. Reference document is NHRS. It is an integrated system, and mainly what is the role of that? To generate knowledge for the equitable health development. And some important functions are there: develop national health research plan, set priorities, target 2% of national health expenditure, track funding, develop indicators for the research impact, assess health system effectiveness and the equity outcomes. ये सारी चीजें important है further research के लिए. I am not going into the detail because this has been given in your book in a very elaborative manner. So there is no point to dedicate so much of time on this part. What are the function of that? Okay. फिर जो दूसरा पार्ट मैंने बताया था, that is the National Health Research Management Forum, NHRMF. They are the advisory in nature for the policy implementation. And who are the members under this? The ministers, secretaries, scientists, state reps, and all that. And what they do actually, they are involving in the stewardship, that is the leadership, norms, advocacy. They also see the financing part, from where the resource is to be given to the various research project, health research project running by the various agencies. Resource allocation means there must be some kind of transparency. And ultimately aim is the same, that is the knowledge generation. And after generating some kind of knowledge or some kind of result, that should also be utilized on the practical ground. That is the aim of this NHRMF. और ये सारे जो हैं, ये सारे पार्ट हैं नेशनल हेल्थ रिसर्च पॉलिसी के. Then we talk about this 10-point program. This already has been given in your book. One is the harmonized intersectoral policies. As I told you, कि health cannot be work in a siloed. अकेले काम नहीं कर सकता. You have to involve the education sector, agriculture sector, lot of the other things. फिर promote holistic research, social science, traditional medicine, all these kind of things. Facilitate priority setting, encourage basic research and the innovation, foster translational result, that is very important. Link research to the national health program or various national goals, build capacity in the rural and the urban setting, leverage global knowledge also. Okay. Suppose already some knowledge is available globally, there is no need कि again you are doing the research on that. The research means वही होता है कि you have to do something very novel which has not been conducted previously. That is the research. And if you are doing the same thing, so that is not going to be considered a research. So that's why when you are writing some kind of research article or paper, it it has been reviewed or it has been assessed very vigorously. कि ऐसा तो नहीं कि ये जो रिसर्च आपने दी है ये पहले किसी ने कर दिया है. And this is very important. That is this referencing part is also there. कि आप यदि एक दो लाइन या if you are taking some part of from the previous research, you have to give due credit by giving them the citation and the referencing also. Okay. तो ग्लोबल डुप्लीकेशन ना हो. ट्रांसलेशनल कोलेबोरेशन, ये भी मैंने बता दिया. ट्रांसनेशनल कोलेबोरेशन, if some country has a good thing, तो फिर other countries they can follow that thing. Generate evidence for the equity and the poverty reduction. This is the data part. ये we have to collect the data to justify कि our policy, our research, they are going into the right direction and they are able to make the things equitable and the finally the healthcare expenditure that can be reduced. And there are some challenges also. Weak research infrastructure in medical college, research infrastructure, that is a big problem. As I initially told you, कि Indian government they are giving very less amount of the GDP on these research activities. While as we have tremendous research potential, but we are not getting the monetary support. That is why nobody is coming to this field. Limited translation of the research into policy. This is again a big. बहुत सारे scientists है, बहुत सारे लोग ऐसे बैठे हुए हैं कि they are able to produce some kind of result into the lab or in the some research work, but nobody is there to pick them up. मतलब they are the just victim of the bureaucratic system. What I have written in the last line also. There is a bureaucratic barriers, funding constraints. All these are things. You have very good research ideas and all that kind of thing, but because of this, you are not coming up that. So as a public health professional, what can you do? What or how you can contribute? You should advocate for the evidence-based policy, conduct priority-driven operational research. आपको priority decide करनी है, then you have to think upon the research and bridge gaps between researchers and the policy makers. That is very important. कि researcher बेचारे ने अपने research कर ली, but it was not being communicated to the policy maker, तो उसका कोई फायदा नहीं, ground पे कुछ उसका result नहीं आता. So this is all about this national health research policy, and there are three, four slides. I just give you some sensitization on the tribal health research because that is slightly different. So what is the tribal health research? Because as initially I told you, they are the marginalized population, they are vulnerable population, they have a unique kind of health challenges, lot of disparities are there, lot of socio-cultural factors, determinants affecting. This is they are achieving some kind of indigenous medicines. तो ये बहुत सारी प्रॉब्लम होती है जो ट्राइबल एरिया में होती हैं. Then we talk about this biomedical disease prevalence, genetic, social, lot of cultural belief, access barriers. These are all the peculiar problems of the tribal health research. Then environmental livelihood, unka jo living condition hai, that is a different kind. Nutritional factors, sometimes they are surviving only on the local food, which may be the deficient in the some micronutrient or the some kind of protein and all that kind of thing. So ये सारे issue tribal उसमें होते हैं. And why this tribal health research, why matter? It is supposed to be seen as a different part because they are the responsible for the high disease burden. Because whenever we are talk about some mortality or something like that, it caters the whole population. It is not like that we are catering only the urban population or the rural population. It caters the whole population. So the tribal group, they are just multiply the malnutrition rate, mortality rate. Why? Because a lot of challenges are there, which already I have mentioned. Marginalization, क्योंकि ऑलरेडी वो मार्जिनलाइज हैं, वल्नरेबल हैं बिकॉज ऑफ लैंग्वेज बैरियर, बिकॉज ऑफ द जियोग्राफिकल isolation, and most of the time these tribal people they don't have believe in the trust in the healthcare system. तो ये सारी चीजें होने से there are a lot of disparity in this problem. फिर cultural nuisance is very much higher in the tribal, कि they believe नेचुरल नेचुरल प्रैक्टिसेस. ओके, तो उसमें क्या होता है कि समटाइम्स इट में बेनिफिट, बट समटाइम्स ऑन द कंडीशन इज सीरियस, देन दे ऑफ कोर्स उनका जो ये डिपेंडेंसी है नेचुरल चीजों पे, डेट कैन हार्म टू द हेल्थ ऑफ पीपल ऑल्सो. जैसे आज भी ट्राइबल एरिया में दे बिलीव कि सारी जो डिलीवरी है दे शुड बी कंडक्टेड एट द होम, but you know कि that is not a very safe concept, and उनके इस behavior से for because of their this traditional belief, mortality rate is going to be on a very higher side. Okay, so that is the thing. फिर then what are the ट्राइबल हेल्थ रिसर्च में what are the challenges हैं? पहले तो access is very difficult. If some researchers they want to do some kind of research, so it is very difficult to get the data because most of the tribal population they are living in very remote areas, but that is very difficult. Then trust, it is again very big problem. If your research is something like that, you have to take the interview or something like, then they are not ready for that. They are reluctant for that. Then policy gap is also there. Lumped with the rural health, मतलब इनकी रिक्वायरमेंट अलग है, बट समटाइम्स वी आर कंसीडर द ट्राइबल हेल्थ along with the rural health, while as tribal health research is something different. उनके हेल्थ प्रॉब्लम अलग है, सब कुछ अलग है, तो वी हैव टू थिंक अपॉन दैट. ओके, this is one model, Kerala's community-based palliative care model that is globally accepted. Okay, it is a very good model. And वायनाड इसमें इन्होंने क्या किया कि जो ट्राइबल एरिया में था वहां पे जो यंग पॉपुलेशन थी, some NGOs, some agencies, they came up and they have given the training for this palliative care or the home-based care. And उसके बाद उनका एक ग्रुप बन गया. तो वायनाड में they have identified the people who are bedridden or who are terminally ill and who are living at home. तो ये जो यंग बच्चे थे, and already they have been trained for such kind of activities कि जो bedlying patient है उसका reason उससे ultimately they are going to be die or the device is there. But जो model has been accepted and appreciated globally on very higher aspect, and few other states they also implemented this kind of model is there. And but इस model में problem बस यही है, ultimately problem हर एक जगह you see the problem of the fund. वो जो बेचारे young बच्चे हैं they are doing lot of work, but they are not being incentivized properly. They are getting very less salary. So burnout is very much higher, and over a period they also become reluctant to provide such kind of job. So this is just a stop at this place, and something like that may not be very interesting, but even I try to make it you must understand this national health research.